something else that I kind of wanted to go back before we go any further. You said sleep posture.
Mm-hmm.
So let's talk a little bit about what
Sure.
would be an optimal sleep posture. I get this question all the time, but I'd love to hear your answer.
Well, we instruct our patients never to sleep on their stomach, obviously. Because when you sleep on your stomach, in order to breathe and function, you have to turn your head, and of course that torques the cervical spine.
Puts compression on the cervical disc.
Absolutely. So we encourage them to sleep on their back as the primary posture, or of course on their side, not to tip their head in one direction or the other. We try to maintain the typical lordotic curvature. I like soft pillows on the back. And basically, you know, sometimes it's difficult for the patient, but if we can treat both their jaw and their cervical dysfunction, then sleep posture becomes more comfortable for them. Otherwise, it does not. So sleep posture, just like work posture, is an accommodation.
Right.
Is an accommodation.
Yeah, I find sleep posture, and people always think that, you know, I think it's the way that I sleep. And the reality is your body finds a comfortable position. It's adapting to its contractures and compensation. So really when you sleep, you're finding you're actually falling into the pattern that your body is most comfortable in. If you actually, these muscles are contracting, if you're stretching out a muscle that wants to be contracted, you probably won't fall asleep until no matter how hard you try. So there's definitely a mechanical aspect to that.
That has a greater mechanical impact on the cervical spine than the TMJ, but indirectly on the TMJ, because, for example, if a patient were to fall asleep on the couch in a twisted kind of position, okay, then of course there's a compression of the cervical nerves, right, and then that has an impact on the trigeminal system.
Sure.
All right, so indirectly, patients come to us often with facial pain, facial muscle pain, with a primary cervicogenic origin.
Right, right.
Right, and that's very, very common. And that's why it's so important to at least understand the two systems and know that we cannot treat one without the other appropriately.
You know, one thing that I appreciate, and I applaud you for your opening your office. You have a chiropractor in the office. You have a chiropractor that uses a technique called Atlas orthogonal, which is a very specific chiropractic technique that deals with the atlas, which is the very top vertebrae, and the most important vertebrae in the body, by the way. For years, the atlas has been the focus of chiropractic, and everything else has been, you know, in some schools even secondary to that. So you have a chiropractor in your office, and you've used that in conjunction with some of your care. Could you tell me a little bit about that, or tell the folks a little bit about that?
Well, the type of technique that we use is called Atlas orthogonal therapy. It's based on percussion and actually realigning the atlas bone. Now, the reason why we brought this into our practice specifically is because it's direct relation with the TMJ, and in terms of structure, and in terms of referred pain patterns. Okay, we're one of the only practices in the country that I know of that are really combining this particular therapy. All right, I actually introduced to the Atlas orthogonal chiropractic group the fact that TMJ problems affect their patients. So I've given a few lectures to their group down in Atlanta introducing that your patients are presenting with TMJ problems, and it is prudent for you to recognize that. If you choose not to treat it, fine, but you must recognize that, like we have to recognize the fact that my patients with TMJ issues have cervical dysfunctions. Right? And going back to treating one without the other is just inappropriate, as far as I'm concerned. It is a gentle technique, as you're aware of, and we are able to monitor it radiographically that the atlas is in the proper position. We've had tremendous results. We're doing some studies whereby what happens to the occlusion or the bite when the atlas is in the proper position. So we have a computer-guided instrument that I can register a person's bite before and after the atlas is adjusted. That's why it's so critical to have right in my office.
That's fantastic. So is that part of your protocol? So instead of, obviously you can't X-ray every treatment,
no, right.
but you have an instrument that you
absolutely.
a piece of technology.
And I think some of the results, and we serendipitously found that this was occurring.
Right.
Whereas, in treating the neck, and the patient would come then directly into my room, I found that their bites were changing. So I said, we need to investigate this and why this was occurring.
And I'm curious to ask, and I haven't asked you this off camera or otherwise, but have you seen any chiropractic miracles, by you replacing this atlas where it's supposed to be? Have you seen any thing in your office where patients have come back and said and told you about maybe seemingly unrelated healthcare issues have resolved?
Well, we really focus on the head and neck symptomatology. So we would typically ask them post-treatment, are your headaches improved and so forth. Ear-related symptoms, okay, are another big component through the, greater occipital and greater auricular nerve patterns. So some ear symptoms do resolve from that. Headache is a big part of symptom resolution.
Absolutely.
Typically, because I just wrote about that.
Right.
As far as patients come to us saying that they have migraines, they've been suffering from migraines for many, many years. They're on a list of 9 or 10 different medications, and they just don't know where to go. And their clinician, their headache specialist would say, well, maybe it's a TMJ problem. Go see the dentist in Clifton. And there's no doubt, 100% of the time, they have a structural dysfunction.
Right.
We find exactly where their headache is coming from by their headache pattern. Neck-related headaches have a certain pattern. TMJ headaches have a certain pattern. They're not typically migraine. Although migraine does exist.
First question you have to ask is, who told you it was a migraine?
Well,
and they said, well,
anyone
that has a headache,
that's right,
or at least
bad
a bad headache,
it's a
migraine.
It must be a migraine. Right. And they'll say, well, I don't get that kind of headache.
Right.
I get this kind of headache, and they'll come with different forms of headaches.
Sure.
And that's all well and good. We're not denying the fact that migraine does exist. Migraine is a trigeminal vascular accident.
Absolutely.
So it's the trigeminal system, the nervous system, and it has. But if I can't find, and there hasn't been too many cases where we couldn't find a structural reason
or
why this patient has.
You're compounding musculoskeletal headache on top of migraine.
Well,
you're still going to get some.
That's
and just to add to that, anytime there's an arm pain, they come in and it's carpal tunnel. Anytime it's a back pain, it's sciatica. And I'll ask, who told you that? And it's my cousin told me. He had it, and so everybody self-diagnoses.
But we in the medical community, medicine, dentistry, chiropractic, we all do our best for each and every patient. There's no question about it. And we see whatever we are trained to see, and we do our best. And we can't help everyone like you can't help everyone. And we have to know where, okay, we've done our best, and now it's time to move on.
I'm going to tell you about the first chiropractic adjustment. I don't know if you've heard with the first chiropractic adjustment in Dr. D.D. Palmer. He was a magnetic healer. He was the first chiropractor. And the first chiropractic patient, his name was Harvey Lillard, and he was a custodian in his Davenport, Iowa office. And Harvey Lillard, his story goes, when he was young, he bent over and he heard a pop in his ear, and he never heard another sound out of that again. And so Dr. David Palmer and Daniel David Palmer, he did an examination on him, and he found that his atlas was out of place. And he asked him, through some convincing, got him to get on the table, and he delivered a specific adjustment to the atlas. And the story goes, Harvey Lillard restored his hearing. So the first chiropractic adjustment was not for low back or neck pain, as some of you may think, but it was actually to take the pressure off of the nerves, to have normal function. In this case, it was to restore hearing. And you had mentioned the hearing issue.
Hearing, when patients present with ear-related symptoms and trigeminal neuralgia or nerve type of pain, those are the most challenging, because the longer they have the dysfunction, the more irreversible it becomes, the more chronic it becomes. So if we feel that the atlas misalignment was contributing to it, or if a TMJ issue was contributing to it, and they've had it for many years or even decades, and then we do our treatments, our prognosis is really guarded because of the irreversible nature. So that becomes more of a challenge. So the more acutely we see a patient with their pain, the better chance that we can resolve.
Sooner the better. Don't let it wait
That's
for too long. So you've been being in practice for as long as you have, and we do want to talk about how it affects lifestyle, how it affects people's lives. So if you don't mind, and we're talking a lot about the clinical aspect of things, but if you have maybe a story or somebody that sticks in your mind that you came in and I know you're a very humble person, so you're not here to toot your own horn, but I think it's important for people to know that it could be, to some of these people, it's life-changing.
The biggest thrill we have in our profession is when you're able to help a patient, especially a patient that's been